Hello, my name is Dr. Mario Ademai, and I'm a physician here in the United States in Los Angeles. And I'd like to present to you my proposal for an efficient, effective healthcare system for the United States of America. This proposal is called the People's Healthcare System. So before we get into the details of the People's Healthcare System, let's talk about kind of the problem that's at hand. First and foremost, I think with the efforts that we've seen recently, we need to have a plan that's with the values of both political parties, all parties actually of the political spectrum, because at the end of the day, this I think is the most important issue that we have to take care of as a country with the values and input of both sides of the political spectrum. So the medical system, from the perspective of a doctor at least, the medical system is very inefficient. There's a lot of healthcare gaps, there's a lot of subsets of the population that fall through these gaps that either do not have any coverage at all or have unaffordable coverage, which is just like not having any coverage at all. Another point is that, the United States invests a ton of money in the healthcare system overall and gets very average health outcomes for the amount of money that we put into it. There's this nonprofit organization called the Commonwealth Fund. A couple of years ago they did a study where they compared countries similar to the United States. They compared a total of 11 countries similar to the United States, and they compared their healthcare systems. Of these 11 countries overall, and among many of the subcategories, the United States did not rank number 1, did not rank number 2, not number 3, 4, 5. It ranked 11th, dead last of 11, in terms of the overall healthcare system that we have. The United States, that's it being ranked dead last would be something that wouldn't be as upsetting, or it would be believable if the United States did not invest as much money into the healthcare system as these other countries. However, the United States invests twice as much as the other countries. I remember the figures were for the United Kingdom, which was the overall number 1 healthcare system ranked in that study. The United Kingdom spent a little over $3,000 per capita on their healthcare system, as compared to the United States, which spends over $8,000 per capita on their healthcare system. So, this video is not about the problems, however, because we know that there's numerous that we see on the news every day. This video is about the solution, and I believe that this model will be a good solution to help fix some of these issues with our healthcare system. So in designing the People's Healthcare System, the main thing I kept in mind during the entire process of designing the system was, who are the vulnerable populations? I believe the vulnerable populations that the United States medical system currently fails to provide adequate coverage for are children, those with disabilities, the veterans, the low-income families, and then another group that we often don't think about, which is the middle class, especially the lower end of the middle class. This group, this economical group, is a group that often gets forgotten about, and they don't make enough money to be able to afford private health insurance plans, and they also make too much money to be able to qualify for government assistance programs, so they're left with poor options. They're not left with many options and usually inadequate coverage. And I know this because my family, during most of our lives here in the United States, has been in this financial class, and we often found ourselves undercovered, underinsured, and without many good options because of this. So keeping those populations in mind, this is my proposal for the People's Healthcare System for the United States. First and foremost, it starts as 2 categories: standard healthcare, which is general care, general healthcare insurance, and preventative care. Preventative care, I think, is underutilized here in the United States. Preventative care includes services like cancer screenings, diabetes, hypertension screenings, your regular doctor visit every year where you do your routine blood work to screen for different things, lifestyle development, nutrition promotions, exercise development, etc. Studies have shown that when you invest in preventative care, 2 things happen. 1, you get a healthier population, which for me as a physician, that is the most important outcome. But 2, you end up saving a ton of money in terms of the overall healthcare system. And we'll talk about the money aspect behind this plan, because my main goal is to be able to make all these changes to our current system without raising taxes. So, that is preventative care. I believe my first proposal is to make preventative care completely free to everybody, no exception. Preventative care is an entitlement, in my opinion. I believe we're allowed to have the right to be able to prevent disease in our bodies, to do what we can, to use the resources that we can to prevent disease. So I believe this should be universal coverage, and basically your insurance card would be your driver's license or your state ID. I also propose that we expand some of our government programs currently. Currently we have Medicare, Medicaid, and the VA affairs, the VA hospital system. My second proposal would be to expand Medicare to include coverage for not only the elderly and those with disabilities that it currently covers, but to expand that to also include all children under 18. I also propose that we expand Medicaid to cover not only just the low-income families, but all students, all college students, grad students, university students. The VA affairs, I think, is functional enough. It's not perfect, but I think it's functional enough to be able to be run by the government still. And then my next proposal would be to make the free market a truly free, competitive market. Health insurance companies, private insurance companies should be able to compete with one another, not be prevented, by state borders or whatever other restrictions, so that they can drive the prices down and make insurance affordable, especially for our middle class, because they are the ones who take advantage of the private insurance plans. However, going back to that lower end of the middle class, the very vulnerable population in my opinion, usually they don't make enough money to be able to afford even private insurance, and they make too much money to be covered by programs like Medicaid. So there should be a government basic plan that should be a part of the free market. This government basic plan will be in direct competition with private insurance companies. It will be just like another insurance plan. However, it will be much, much more affordable. The reason this can be much more affordable is because the government has buying power. They can buy in bulk from pharmaceutical companies so that their medications for their plans can be extremely low and affordable for all the people in the United States. So with all these changes, you basically have completely universal coverage when it comes to preventative care services, and you fill in all the healthcare gaps, in my opinion, as a physician, of the most vulnerable populations. So you have plenty and affordable coverage for everyone, including the low income, including students, the elderly, those with disabilities, children, our veterans, and it'll cover everyone so that no one is left behind. Now, the most important question I'm sure a lot of you have, and the most important question to answer when you come up with a proposal like this is, well, how is this going to be funded? Expanding programs is fantastic, but how are we going to do this? Studies have shown that when countries invest in preventative care, they are able to cut down on all the expenditures, the wasteful expenditures within the healthcare system. The Harvard Business Review estimated about $1 trillion of healthcare expenditures that are completely wasteful in our system currently. When you implement preventative care, you prevent disease, those chronic, costly diseases from occurring in our population, such as diabetes, such as hypertension, heart events, heart attacks, strokes. And when you prevent those diseases from happening, you're going to cut down on all those costs that you would have spent to help take care of those people. But why not just prevent those people from being sick in the first place? Studies have shown that preventative care is the way to do that. On top of that, though, even though that already will make up enough of the cost to be able to cover the expansions of these programs as proposed, on top of that, the United States, 25% of every dollar that is invested in our healthcare system goes towards administrative costs. 1/4 of every dollar that we spend in the United States goes to administration, just to run the programs. And the reason is because our system currently is too complex, it's too inefficient. When you come up with a very tight-knit system, a great combination of government programs along with a truly free market, you will have cut costs on all those inefficiencies, on all those administrative costs. So, this is the people's healthcare system. Again, my proposal will not require any tax increases. The funding will be coming from the savings that will come from investing in preventative care and with reducing administrative costs. But again, the finances is not what's important to me. What's important to me is that we have a healthy population. The United States deserves to have a healthy population because we spend twice as much as every other country in their healthcare system. And I believe this is the perfect, efficient way to be able to solve that problem. All I ask is for your support to get this on the desk in front of our policymakers. Because an idea is just an idea unless we do something with it. I ask that all of you share this on your social media, send it to family, friends, because at the end of the day, I truly do believe that this is a very efficient system that can help fill in all the healthcare gaps that we currently have and can do it in an efficient way where we won't need to raise taxes on our citizens. Thank you so much for giving your time. I truly do appreciate that. I know this is a little bit longer of a video, but I think this is an important issue, and that's why I decided to dedicate so much time to research and creating a system that I think will be fantastic for our country and our people. Thank you, and have a good day.